see there's an osteophyte down here, a degenerative disc disease, this horrible thing we talk about. What advice would you give to this person? If we put it into context here, here's what it probably looks inside this poor old soul. If you were to use a cryotome and cut them in half, you see the spurs there, you can see some of the degeneration. Something to worry about? That's my spine. So I do heavy clean and jerks. I'm 65 years old, and I'm doing heavy deadlifts. I did jujitsu until not too long ago with that. There's no reason in the world that person should slow down. They actually should increase their activities. That's indicative of an old injury. That's a fire that has burned a long time ago and burned out. Disc, here's a, and I get these images from Wolfgang Roschning from Sweden, who allows me to use these. He has a cryotome that he cuts his patients, he freezes their patients and such. Actually, it's patients or cadavers. But here's a beautiful disc right here, well organized, gorgeous. And then you see the progressive degeneration until it looks like my disc. Normal progression. None of those are indicative of pain. This person that looks like mine. I have zero pain. These others, and this person may have pain up here. So degenerative disc disease is most analogous to like we see barnacles on a whale. They get more barnacles the longer they're in the ocean. It doesn't have to hurt, but it just shows you've aged. It's like as you get wrinkles as you get older. As I get wrinkles, you wouldn't tell me I've got degenerative face disease. Maybe you would. Yeah, he does. But that's what it is. So when you tell somebody they got degenerative disc disease, it's analogous to saying you've got degenerative face disease and you've got wrinkles. It's normal part of aging. The Dunning-Kruger effect, you're all familiar with. But basically, when you learn a new activity and something new, your confidence levels goes up. When you're in chiropractic college, you just feel like you have all the answers. Or if you're into karate or marksmanship or scuba diving, when you first start off, you have that period where your confidence goes way past your knowledge. But then later on, we humble ourselves as we realize how much there is to learn. And we can't tell where we are in this graph, but it's probably here for a lot of people. And I get stopped by students quite a bit. Hey, Dr. Morgan. And they'll stop me in the hallway, and I've been doing this for many years. Have you thought about this? As they introduce chiropractic that's 125 years old, and they've been grabbed by somebody out in the field, and they're basing their practice on the Gerlich model of neurology that was established in 1871, the reticular theory of neurotransmission, so that it's like, yeah, actually I've been there myself. We're trying to move our students forward, and they actually embrace a form of wizardry and have that really strong confidence. What I want from our students is that they have confidence, but not certainty. When you have certainty, they're no longer curious. We want to make sure we engage them in curiosity and research. We want to make sure that they don't make huge leaps of faith. And as our previous speakers have talked about, evidence-based care, I think this model's been out for 20 years. We use the best available evidence, clinical experience, so that there's a small leap. Very little. There's usually a little bit of a leap. But if we were to build a bridge from the other side, it's also would fill in with the patient's preferences. They chose you. It's our job and what we do here at Parker University and throughout what the WFC is trying to do is to keep lengthening that bridge. That's our job. I'm going to give everybody a public service announcement now about an intervertebral disc disorder that virtually every one of us will see and every one of us will mismanage. Every medical doctor will see these and mismanage them. Cervical spondylotic myelopathy. It's common in most of our practices. It's where you have degeneration to the point where it actually puts pressure in the core, causing myelopathy. Let's say you start a practice, you're 30 years old, when your patient is 40 years old. As they get older, you did that initial first examination, but they come in every month or so and they're adjusting and they feel better with their adjustments. You keep treating them and treating them. And as they get older, they start developing these symptoms. And the symptoms are kind of a wide gait, they're clumsy with their typing, maybe a little fecal and urinary leakage. But they attribute that to getting older. It can be myelopathy that you slowly preside over. And by the way, they feel better with adjustments. Through my